science has been extremely good over the past few months and has delivered, thanks to a lot of basic research and applied research, a product that we all were thriving for, which is a vaccine. It's a very good vaccine. It works. I think we should make sure that we all use it and we take this as a tool to get out of the emergency situation in which we have been plunged for the past 1.5 years. That doesn't mean that the virus is going to go away. The virus is going to here to stay for many, many more years. So we need to use the tools that public health, that pharmacology, that immunology has given us to get out of the pandemic.
Yeah, in a lot of this part of the world, like Hong Kong, Australia, there's a sort of a so-called zero COVID approach where they're trying to get infections down to zero or very close to that. In your opinion, is this a realistic strategy, especially as the months drag on and especially considering we now have effective vaccines?
Personally, I think that it's very difficult to keep a zero COVID strategy if you want to re-establish normal relationships with all the countries around you. I think that most other countries, certainly the countries that have strong economic ties with Hong Kong, with the exception of the mainland, of course, they are not using this approach. That means that both in terms of tourism and business relationships and travels, etc., they will always be a disadvantage if Hong Kong wants to pursue a zero COVID. But again, I mean, of course, this is a decision that rests with the government of the Hong Kong SAR. But I don't think that it's going to be easily sustainable in that respect, yes.
Throughout the pandemic, one of the refrains has been to trust the science, trust the experts, and I think we all would agree that that's important. But at the same time, don't we ultimately have to face a political or a societal decision at some point, which is what level of disease and what level even of deaths that we can live with? Yeah. And if so, why aren't we having that conversation?
Well, this I don't know. I wish we could have this conversation and it could be really a more societal discourse that doesn't count only the number of new cases or the number of people that are unfortunately in ICU and the number of fatalities, which are of course very sad to count every day. But we should consider the fact that it is really important now to take into account that science has delivered. So if we listen to the science, we know that vaccines work very well, that more than 90% or 95% of severe cases are preventable with vaccines, even with vaccines that are not sterilizing vaccines, but they prevent the very severe cases, they prevent fatalities. There was a study, I think, published today or yesterday in the New England Journal of Medicine, precisely from Chile, where there had been a huge vaccination campaign with one of the Chinese vaccines, and despite the fact that they had a surge in the number of cases, the case fatality rate was down considerably. So we have trusted science. Science has delivered. Now I think that the political class need to take this into account and find solutions to get us out of this precarious situation.
The vaccination rates in Hong Kong, Australia, New Zealand, many of these places that have more or less or close to eliminated the virus are still quite low. Yeah. In your opinion, what would be a sensible or realistic target for getting the vaccination rate to a certain level and then saying, okay, we're now opening the borders, we're now lifting all restrictions maybe, except for some minor things like wearing masks and personal responsibility?
So I think that one could definitely think about that and consider the number of doses that are available in a certain country or in a certain region, what is the level of daily vaccinations one can provide, and making sure that there is enough information everywhere, and then set up a date after which, if people do not want to protect themselves, I think that the burden of these restrictions should not be borne by all the population.